We have some patients who come in straight from the accident and emergency department who are really sick and need our care urgently and pretty much immediately. We might have a patient who's been on the ward for a period of time and become increasingly unwell and then needed a step up to critical care. Or we can have patients from theatres. They could be somebody who's having a major elective procedure who needs 24 or 48 hours of close monitoring and support and care post-operatively. Or they might have had an emergency surgical procedure and again need critical care support post-op.
Whilst you've been in critical care with us, we've been looking after you using monitoring. We can keep an eye on your heart rate, your oxygen saturation, your blood pressure. We can have a look at your respirate, and we can use other things, temperature and things like that, to help make the decisions that we make to help you. Whilst you've been with us on critical care, we will be giving you fluids and drugs to help with your care. And these are the pumps that we've been using. This one here is a fluid pump, and the bottom ones here are the syringe drivers that we'd be using for the drugs. You may well have had a tube that we use to help with your breathing. This is a ventilator that we would have been using on the unit to help with your breathing if you had a tube in place. You may well have had invasive monitoring that involved a cannula or a line in your neck. You may have had other procedures done that we needed to see where we were going. And this is one of the machines that we would be able to do that with. This is an ultrasound where we can see where we go in your neck, where we might go into your wrist. We can also look at your tummy and things like that. So this is a very helpful piece of equipment that we have on the unit.
Despite all the machines and technology we have to help patients recover from critical illness, as a team, we always keep in mind the fact that we are looking after a person first and foremost, as well as their family and friends. That is why we place equal importance on ensuring the psychological well-being of patients as part of their recovery process.